Hi friends, morning. I'm Dr. Ashutosh Gupta. I'm a consultant in fetal medicine. So today we are going to talk about the COVID infections and pregnancy. Okay, so the pregnancy is not a high risk for to catch up a COVID infection, but a pregnant woman who has got this COVID infection and is 2 times more likely to end up with some complications and a severe COVID infection, right? So as you know, this COVID viral infection leads to inflammation and vasculitis, right? So this might lead to an uteroplacental insufficiency, might lead to an high umbilical artery resistance, leading to some derangement in the amniotic fluid index and an IUGR to the baby. So both symptomatic as well as an asymptomatic pregnant ladies with COVID infections, they stand 2 times higher risk, 2 times more likely to end up with the preeclampsia, uteroplacental insufficiency, IUGR. They might end up with an emergency cesarean sections and some complications to the baby, like in stillborn babies. Okay, so I have got some 6-7 cases in which this COVID infection has done some harm to the baby as far as this uteroplacental insufficiency is concerned. So this is I'm going to tell you now. This is my case 1. So this COVID infection has led to anhydramnios, high umbilical artery resistance, mesenteric ischemia, grade 2, grade 3 echogenic bowel. Whole of the intrauterine cavity is filled up with blood, right? So vasculitis leading to intrauterine cavity filled with blood. Case 2, so you can identify that the AC's growth is stagnated. Okay, so the AC abdominal circumference is stagnating. This is the case which we were following it up across, and we identified that the uterine arteries are falling, the resistance is falling. But post-COVID infection, this AFI has dropped down to less than 50th centile, and the uterine arteries which were decreasing, they have started to go up again, right? So they are now beyond the 95th centile on the right hand side. This is case 3. So as you can identify that the uterine artery की जो resistance है वो 90th centile के ऊपर beyond चली गई है. So this is another case. The uterine arteries were less than 50th centile, but then they have again started to move up. Case 3, both RI and the PI of the umbilical arteries are beyond 90th centile, very high for the this thing. Gestational age, oligohydramnios, AFI of 10.3, and then the uterine arteries are also very abnormal, so they have gone greater than 95th centile for the gestational age. Case 4, the long bones, they have started to show some lag. As we come on to the abdominal circumference, we identify that there is some element of an intrauterine growth restriction has also started to appear, and the umbilical artery resistance has also started to move up. So this is at and greater than 90th centile. The umbilical artery PI is also very high, right? So uteroplacental insufficiency along with high umbilical artery resistance. So the uterine arteries are very high, right? And this is how. So friends, as I've told you that the COVID infection in pregnancy makes them at a high risk to end up with an uteroplacental insufficiency, high umbilical artery resistance, very high, and then it goes down the hill very, very fast, right? So in these scenarios, so the heparin has come up as a very good tool so as to manage all these things. So heparin has been identified to decrease the inflammation, to decrease the apoptosis, to increase neo-angiogenesis. It has been identified to have some anticoagulant activity. It also promotes those proteins which helps us in a neo-angiogenesis, right? So the heparin, low molecular weight heparin, can also work as a preventive strategy to deal up with this uteroplacental insufficiency and to manage, and so as to manage this pregnancy in a condition which is salvageable, right? So early surveillance to identify the uteroplacental insufficiency, high umbilical artery resistance, oligohydramnios and IUGR, and to start up with the low molecular weight heparin in full therapeutic doses can lead to some prevention of these complications, leading to stillbirths, and can salvage these situations. Thank you very much for your patient listening.